The topic is e-health and e-education, and as Kate Cornick did rightly point out, they probably aren't necessarily the things that are going to get most people's use, but they certainly are the things that get most people's attention when you talk about broadband. So we have a big panel to cover that range of topics and a big time slot for it. So could you please welcome to the podium Dr. John Langley, who's a senior educator with accomplishments across education, business, government and project leadership, and a long CV to match. John? Next is Kate. If you don't have a lapel mic, you need to take one of the last 4 seats. That one there. Yeah. Next is Kate Shevland. Kate has been the principal of Ottawa College for the past 15 years, where she has spearheaded e-learning initiatives. Welcome, Kate. Up the side. It's just we've only got 4 table mics and 2 people have got lapel mics. Then we have Richard Medlicott, who's a general practitioner in Island Bay, Wellington, has a particular interest in health IT issues. Richard, welcome. He is mic'd. Our 5th participant is Peter Gow, who is the Associate Professor in Rheumatology at County's Manukau District Hospital. And welcome, Peter, and you're mic'd as well, so you're up this end. Then Dr. Louise Starkey, who's an Associate Dean of Primary and Secondary Teacher Education at the Victoria University of Wellington. Please welcome Louise. And last, but by no means least, Dr. Kate Cornick, who we've already met. Welcome all. It is a big panel, but we do have quite a time, and the question is that we are turning ourselves overall the drivers of e-health and e-education demand for faster broadband. You have all been given the opportunity to speak for a few minutes first. We'll go through in speaking in calling order. If you're happy to speak from where you are, feel free, or come up to the podium. But first up is John. Thank you kindly. Yes, time does fly when you're up here, and you should imagine what it's like when you've written a nice Dorothy Dixer for your minister, and it's been asked and it's being answered, and you've carefully given him 100 words because he speaks 100 words in a minute, and he's got a minute to answer the question, but he ad-libs in the middle and doesn't get to the punchline of the question before the President of the Senate says the Senator's time has expired, or the Minister's time has expired. So time does fly when you're having fun. Look, that's a really interesting set of views, and I think I want to ask the first question based around a bit of what I said in response to the second Kate Shevland, but start with a sort of a comment about something that was coming out of Kate Cornick's presentation. What struck me about Kate's presentation was that she didn't seem to be short of people walking up to IBIS and saying, I've got this problem, do you think you could help me? Am I right in saying that you seem to be not short of people doing that?
We are definitely not short. We are totally under-resourced. If we probably get an email a day of someone asking us to help or someone asking us to collaborate, and we cannot meet that demand.
Because I mean, that's the comment I made when Kate was talking, where she'd made that reference to the idea that you know, teachers have got these technologies, they use them and they want to use them teaching. This does seem to be a different conversation to how even this conversation would have run 3 years ago. We're not talking about e-health and e-education as something where you've got a reluctant professional base. You've got a professional base that's now saying, we understand what all this can do, we just can't, we need some help to make it happen. I'm seeing some nods. So do we have any comments on that? Or?
I'll have a comment.
Yeah.
Some of the drivers need to come from, well, I call them patients. I know it's old-fashioned, I'll stick with it as I'm a doctor, I guess.
I think you can call them patients.
If we're looking at primary care, 50,000 consultations in this day in primary care, 5,000 in secondary care. So the point that you made, Kate, I think was very valid earlier on, is that a lot of people are fit and healthy, and we need to be focusing on the people with complex needs, or those people who've got a bit of spare cash and want to spend it on a fancy new way to interact with their doctor. But those costs can be very high. As I was saying before, it's $5,000 for a nice machine which will take your blood pressure, your oxygen saturation, your blood glucose, and send it to your practice nurse or doctor. And we've got to evaluate that very carefully, that we're getting good results for our money.
Anyone else with a comment? Kate wants to say something?
Yeah, oh, sorry, you can.
Is this on?
Yeah, it's on.
Yeah, I agree with that. And talking about New Zealand's educational standards, they are high internationally, but we are aware that there is a big tail, and that's not just common to New Zealand, it's actually the same in Australia as well. And so the resources really do need to go into that tail to try and lift that, and I think that's where the use of very engaging and effective technology will show huge benefit. And I'd also say that a lot of people in education now don't talk about e-learning. That's just what learning is now.
Right. That comment about the tail, it just reminded me of a comment earlier in the conversation about unemployed people and people in jail. And when we do sort of some of these exercises, you go out and launch and talk about something like an e-health initiative or whatever, we sort of tend to talk about it as if they're just social. It's a good thing to do. The one I was thinking about was a case in Australia of using video conferencing for early intervention for children with hearing and speech deficiencies. And early intervention makes a huge difference to how well they get to hear, especially. And if you make that early intervention, they can then do better in their schooling. And if they can do better in their schooling, they're more likely to be employable and equally less likely to go to jail. And it doesn't take much mathematics to start figuring out the huge economic benefit of that. Ditto the tail, making the tail more productive, for want of a better word. These are huge economic benefits that sometimes get lost because they get thought about as being they're just about equity or social concerns, but they really are just as much economic.
I think it's a learned helplessness in the education and the health system. I think that rather than people saying, well, what can you expect of the public health system, for example, rather than people saying, look, we expect the best as a consumer, this is what my expectations are, and let's work together on actually delivering that. I think that until we start doing that, until we start using patients to sort of leverage what their expectations are, then we're not going to improve. And there's a very nice website in the States called Ask Me 3. What is the matter with me? What do I have to do to improve this, and why do I have to do it? And often the third question either isn't asked or it's not given by the doctor, and then we get frustrated because only half of the patients are taking their medications.
Right. I think I understand that. Yeah.
A really pertinent comment, and I think your original question about, we've moved beyond the sort of trying to move the health and education sector along. I think that's true. There are certainly lots of really willing doctors that understand the benefits, and there's lots of really willing educators that understand the benefits, but there's still lots out there that don't. And it's not that they don't, it's that they don't have the time. We're talking about people with incredibly busy lives, incredibly important jobs, and we've got to design technology that is really seamless. And I don't know that if someone was talking about video conferencing earlier today. We use video conferencing all the time at IBIS, and it's never been straightforward, even though it's in our field. There's always something goes wrong with a piece of equipment. Until you can really build technology in that's seamless and is easy to use and doesn't take time, and you can actually start to reap the benefits in a productivity sense, then you actually move beyond where we are at today.
I could suggest you stop using video conferencing and just use FaceTime, but I won't. But it does sort of strike you that sometimes someone, crazy man called Steve Jobs, who just was a very demanding boss, could make some things happen. Okay, I've asked a first question. I've got miles more I could go for, but other questions from the audience?
There's Wayne Hope from Auckland University of Technology. I'm an associate professor there in communication studies, but I, in a previous life, was also a secondary school teacher. And I've just got a question for Kate and Louise about library resources and curriculum development. And I have two questions, actually. The first question is, do you envisage, if we just stick to high school, do you envisage high schools becoming more dependent or using broadband connections as a basis for library acquisitions or a basis for setting up subject knowledges and as a basis for teachers building up their curricula? And if your answer to that is yes, what does that mean for schools who are in lower decile areas or who are way up in the back blocks who aren't connected? And my second question is, if we are moving towards an area where broadband is becoming synonymous with libraries and curriculum development, what does this mean for the traditional hard copy library? Do we just abolish them?
I think the answer to the first question was yes. The answer to how do we make sure that's spread through into rural areas is, I think, something that this whole conference has been trying to perhaps get a bit of lobby and pressure for, because I do think it's something that needs to be expected everywhere. Having said that, I don't see that a library as such will disappear, nor will books disappear. I mean, they will be less common, but I think there will always be some sort of blended learning, and I think there'll always be the need for information centres like libraries where people can congregate face-to-face as well. And I'd also like to acknowledge, if you are from AUT, that they have been in touch with us about teacher training using such devices as iPads, which we were very pleased to hear, because one of the issues with teacher training is that aspect of education seems to be less involved with technology sometimes than what's actually happening in the schools.
And Louise, did you have a comment?
Oh, I could probably comment on the last one. I'm involved in teacher training, and we we certainly do involve the students with the digital technologies. Yeah, I think the rural broadband issue and the if we can get ultra-fast broadband in rural areas, I think that will help access to information. Books in the long run, I'm not sure what's going to happen to books in the long run. That's not really my field. I think the online aspect will make them become less relevant, less interactive than the online alternative. Yep.
John has a contribution as well.
Yeah, the debate between teacher training and practitioners is a hardy annual. I would love $1 for every time it's been raised as an issue over the years that I've been involved in education and teacher training as well. I think what we're saying here is that there is a disconnect at times that exists between what's actually happening in the profession and what's happening before and during the induction processes and around professional development. And that actually wasn't really addressed in the paper. And that is, how do you link those things up, and how do you get people on all ends of that divide actually saying sensible things about it, which at the moment really doesn't happen. In other professions it tends to happen a bit better, in medicine and law and so on. The input of the profession into teacher education or the training programs is quite profound. It's really interesting. I spent the last week in San Francisco, and the links between the IT industry and the universities there is again quite profound. And what we have to do is to look at the ways in which those links and the knowledge generated and the ways in which people pass from the training process into the induction process and through the professional development process is consistent and meets the needs, and not just the current needs but the future needs of the profession. And so that disjunct, every discussion which ever happens in education, you get the same comments being made.
Can it be facilitated with high-speed broadband?
It can certainly be improved with it, but more importantly, it's about an attitude. High-speed broadband is a means. It doesn't change people's behaviour necessarily.
I understand that. I was just being...
Yeah.
But whilst we're on this subject of electronic resources, I'll have my own bitch about universities. There's one university which I use in Sydney to borrow, to get journal articles from. Now, as you know, journal articles now are only available in the electronic resource. But as an alumni borrower at this university, I'm constrained to one of 4 computers in that library, none of which have chairs sitting at them when I want to access electronic journals. It's quite a bizarre process, but it's the only way I can access the electronic journals at that university, which is one of the ones I'm an alumni of and closest to home. And you know, so we talk about all this stuff about, you know, students and stuff, but universities are actually doing a really, really good job of locking away information from in their library models. But that was just a wild swing. Can I ask a question though about training? Because one of the other things we've not talked about here at all is vocational training, which is an area where I know that in the Australian model we've got some interesting trials going on. And vocational training is an interesting one because it also sort of bridges across into what you could call pastime activity. And if you think about the millennials, one of the things about the millennials is they don't do one thing, they do multiple things. They learn a number of things and do them all at the same time. When you're trying to teach someone a craft, you need to observe them doing the craft. It's a very good application for doing things remotely. Has there been any thought about what the implications for vocational training are of high-speed broadband? Because we've got universities and schools represented, but we got any vocational training? Kate, you want to talk about vocational training?
We certainly give vocational training a lot of attention. We are particularly interested in maths education, and Melbourne University provides outreach to professionals to upskill, and teachers have to keep their training relevant, and Melbourne University is one of many providers in Australia that provides that for maths teachers. We're looking at how we can develop an online program, and it's in very early days. And I think that can be applied across many different fields that require ongoing professional training, but also assisting people to upskill. If you are in a particular area and you want to change fields or you want to reskill, often people who have moved beyond their early 20s and they had the time that they can spend their lives at universities and becoming a student are juggling full-time employment with studying. And I think broadband has got a really important role to play there in assisting people as they undertake new training initiatives.
Okay. Any other thoughts or comments? I mean, I did make this throwaway comment earlier about, using online training to teach people how to build fibre networks, to deploy fibre networks. And let's face it, folks, as someone said, they're mostly construction projects. It's mostly how to get the fibre hanging off the tree or through the pipe, and then you screw it together, basically, from the stuff we're building in Australia anyway. Sorry, question down there?
Howard Baldwin from the Ministry of Education. We don't know where the next Lord Rutherford's coming from. The first one came from rural Nelson, and that's why we're actually getting fibre to 97% of schools, which cover 99.7% of young New Zealanders. In addition, government are rolling out a network for learning that's going to provide applications, content and services to all New Zealand educators around the country, and I think that's something that needs to be clearly understood by people at the conference. Government's very active in this space, and we haven't forgotten rural education.
You haven't forgotten rural schools. You still will have potentially a...
I think the thing is that rural schools, and I used to teach in a number of them, they're centres of the community. So many things spring out of rural schools, and we know that people in rural New Zealand are incredibly innovative. They'll find ways to harvest the ultra broadband connectivity that'll go into those rural schools, and to make sure that it keeps their communities alive. I have absolutely no doubt of that, being a passionate New Zealander.
Okay. Do we have any other questions or comments to this panel over there?
Hi there, Kevin Prince from the Foundation of the Blind. Just wondering if the panel's got any thoughts as to who, and it goes across all of you, because you'd have a patient or a student or even one of the doctors may be unable to access this huge amount of content we're passing backwards and forwards. Is there anyone, who do you think should make sure that stuff is built, that content is standardised and accessible? Because if it's on an inaccessible device or in an inaccessible form, it's not available.
Do you understand the question?
No.
Would you like to repeat it for people who don't understand what you mean by accessible, i.e. able to be read by people with poor eyesight?
Yeah, it's not just people with poor eyesight, it's people with a print disability, I think is the wider term for it. But in particular, if your only access to a computer is via a screen reader, which reads what's on the page, one of the classics is, you were talking about the journals, the online journals. A lot of those are pictures of pages. They're not text that a screen reader can read. And in the future, it's all going to be wonderful, of course, but now it isn't there.
Well, I just have a comment about that. I think that one of the potential, well, the huge potential that exists here is that those kind of issues can and should be overcome because, again, it's a question of trying to identify what it is we're trying to create. I mean, for heaven's sake, in New Zealand at the moment, we've got the first hearing impaired MP and they can't get their act together to service her needs in Parliament. I mean, most of the people in there don't listen anyway. And so the fact that they've now got somebody in there who's deaf is probably... Anyway, I would have thought that actually this is an absolutely particular area, the notion of access, the notion of people being able to do things with other people that they haven't been able to do before is critical. And the way in which that gets defined and the way in which it gets rolled out is one of the reasons that I would have thought, look, I think there's a problem here at the moment, and it's a problem that exists in education, and that is that too many people still think of ICT as glorified writing instruments, data, spreadsheets, glorified dictionaries and information gathering devices and so forth, and it's very powerful. But that's not where the future is in terms of the potential for this stuff. The future actually is around the connectivity that we have with other people as individuals within our country and outside it.
I'll make a comment in terms of some of the healthcare aspects. The low-hanging fruit, which you referred to before earlier, in terms of elderly, the manufacturers of the devices are acutely aware that you need a usable user interface. Yeah. Medication management is dangerous enough if you're doing it yourself, but if you can't make your robot work properly, then it's going to be even worse. So I think clearly there's a lot of thought going into making that work properly.
But I mean, that's possibly even a good example, because if you go to the website of a drug company and get the online brochure version of the product disclosure, you will find cases where what you've got is a PDF of that document and it's a picture of the document.
Yep.
So if you're using a screen reader, you can't read the words.
But of course that's presupposing that it's a good idea to read the data sheet. Have you actually read the data sheet for water? It's horrendous. Immersion for 3 minutes will cause death. Drinking 5 gallons will cause coma, convulsions, death. It's a very bad idea.
No, but I mean okay, well, I actually always do read the instruction. I always do take with a grain of salt the thing that says, be warned, this drug could kill you, because they've got to say that. But it does usually say some useful things about circumstances in which not to take the drug. Sure. And if you've lost the piece of paper that came with the drug, that's the place you take recourse to. Sorry, did anyone else have a comment on the accessibility piece? Because it is actually an important area.
I think you've raised an important point that, regardless of broadband, we haven't really addressed, and that's the end-to-end from the person picking up their prescription, for example, to being able to read it. Is it in an understandable format in English, let alone if English isn't your first language? And there's huge safety issues around there. And I think it's probably that these issues have been overlooked because it's something that the consumer may well be concerned about, but hasn't entered the provider, given it the importance that perhaps it should be.
Anyone else? In the education content, they've got different targets anyway. So, sorry, you had a question, yeah. And then sorry, over here first, over there.
Yeah.
No, Newen. Sorry.
From,
down. I'd already given the call to the gentleman over here. So.
Yes, Christopher Egg from Waiheke. I have a question about community libraries, which would also perhaps affect rural libraries or rural schools. And I want to particularly ask a couple of you there, is that really, with the change of knowledge and connectivity and digital this and that, what do we see as the potential for the future role of community libraries and rural libraries?
I think,
Bless you.
Bless you. I think they'll reinvent themselves.
Sorry, what did you say?
I think they'll reinvent themselves.
Right.
as being centres of information. I think a lot of libraries are already doing that.
Anyone else with a comment?
Yeah, I agree. I think they'll perhaps become more centres of groups of people learning things together as well, not perhaps just getting information.
One of the problems we've got in medicine at the moment is if you can find an abstract pretty easily if you use Google Scholar or another search engine, but the second you want to delve down into a paper, you come up against the Elsevier $30 for 5 minutes to quick have a read of a paper. So we do have problems of accessing detailed information.
There's also an issue around what a community is. There are some places where a community is very obvious, and you know, there are people that clearly define themselves in terms of that particular community. But nowadays, I think there are other parts, particularly of large cities, where that's less obvious. And so maybe one of the discussions, really, if we're talking about community facilities or community communication or whatever it is actually to think about how do people define what a community is nowadays and where it is.
Well, we actually had an example of that earlier when we had Liz up from the Rural Women's Group, and she pointed out how frustrating is running that community, which is what it is, when only half the people are online.
Yeah.
Anyone who's been involved in any kind of community activity, I mean, I've run netball clubs in the past, doing it back in the old paper days was vastly different to what they do these days. They do the whole registration process online. You don't have to, queue up with photos. Just a completely different transformation to that ability to build community when you can build that community online, even though that community is still something that goes out and plays sport. There's still an awful lot of work you have to do. Look, I just had to take that opportunity to use this as my example of a bit about the future. This is my copy of the history of telecommunications in New Zealand. And it's my copy that I bought only last year because I previously had read it from a university library and I thought I'd get myself a copy. And there's a wonderful website a company called A Books, which is now joining buyers and sellers largely of second-hand books. So if you're looking for a book that you want, you can just go to A Books and you go and Google it and search for it and you find the book. And so this book I actually bought was formerly the property of Palmerston North Public Library. When they took it out of their collection, it went into the A Books cycle and wound up in my hot little hands by paying money through the net. So that's the future of your local community library as it winds up in mine. The Australian Libraries Association is actually taking a very active role in trying to make sure that everyone understands the role they can play as communication, as information sources in the online world. And I don't know what the equivalent is in New Zealand, but I do know it's a very active activity of the libraries in Australia.
Can I add, there are a couple of examples in Australia which I think are just phenomenal on the way libraries have reinvented themselves, and one of them is Hume Library, which is in northwest of Melbourne, and they've developed a digital hub. They've managed to get Cisco and Microsoft involved in programs. They're running digital literacy programs. They're doing some phenomenal stuff, sitting embedded inside a traditional library, and I think it's really a fantastic model on how people can engage in libraries. In new ways, as well as in the ways we all are used to. I can't remember if you remember the name of that library. I know it's one of our MPs, Frank Maguire, has been driving that. I forget, it's got a particular name, but I forget what it is.
Been to news.
Global Learning Village, that's it. If you Google Global Learning Village, it comes up. It's a library model. It started in the city of Hume and it's been rolled out across a couple of other areas now. Thank you.
Thank you, Robert. Sorry, I did have Nguyen and then I got two over there.
Thanks, David. Eagle Communications. Yesterday, Richard Bean from the Australian Communication and Media Authority showed a documentary, a training documentary about national relay services for the deaf people. And last night, I came across an article which talked about video relay services in Canada, in Edmonton. And I thought, with the broadband capability, that sort of facility will enhance the life of the people who got disability. And the gentleman who mentioned about the one for the blind, maybe text-to-voice conversion can enhance that capability as well. So that I thought I'd make that comment.
Yeah, but text-to-voice version works as long as you're starting with text.
Yeah, but the thing is, in Canada, for example, if you go to a site, if you speak French, you can press the button Français, and it comes back in French for you. So in the future, it could be a voice control activation, and if you ask for something, it should come up. And as Kate mentioned before, everything needs to be designed from the perspective of the end user, and also everyone in between the chain end to end.
Yeah,
I think that's a great way of looking at it, end to end,
but
starting from the end user.
Who flagged the end-to-end piece. So I had two questions. I think that was a comment rather than a question, wasn't it, Ewan? Yeah. The person over there and then we'll go to Ernie because no, then the person up here, then Ernie.
Yes, Robert Boydville speaking. Very impressed with Kate Cornick, your piece. I just wondered whether IBIS had any assessment or audit of what projects move beyond pilot into actual implementation.
Yeah, where the dollars come from. It's unfortunately, we are, like many research organisations, restrained by what we apply for. So we apply for government grants in addition to our base funding. Our base funding is used to flourish ideas, and then we try to seek additional funding, for example, through federal and state government programs to grow those trials, and hopefully in time, we've been going for 2 years, those will get some larger grants through. We have, last year we got in excess of close to $4 million coming in cash and in kind across 4 projects. All of them are big, and hopefully one of them will actually result in a startup. So it's a slow process. Anyone who knows commercialisation, it's complex, but ultimately our assessment comes from what's going to win the dollars.
The difficulty, of course, being that it's not often in these areas, it's not commercialisation per se, it's not the same as commercialisation, which is usually build it to make money. It's often build it to save money or build it to prove an outcome but maybe spend more money. It's slightly difficult. Anyone else with a comment on that? No? There was a gentleman at the front, I thought, here. Oh, no, it was the lady, I think. It must be the lady, because that's who's got the hand up.
Hi. Elizabeth Jones, National Library, so I do have
good on you.
I just really wanted to just make a comment, given that libraries have sort of floated into the conversation here, and really just to say that I think a lot of the confusion comes from identifying library as somehow being associated with the book, and that is our kind of mental model. Libraries have always reflected the cultural, technological and social context in which they've existed, and going back to Alexandria, so it's a long history. And I believe, and I think the Library Association here, Leanza, much like ALIA in Australia, is very actively, and in fact globally, there is enormous work going on in understanding and looking at the transformational potential of libraries, in some ways to recapture their role as absolutely centres of learning and community and knowledge construction and building. And one of the things that we're very conscious of is people have talked a lot about connectivity and we've talked about content, and the third C is really around capability and everything that means around an evolving concept of literacy, from the importance of early engagement and support to families and communities around reading enjoyment through to everything that transliteracy and digital and multimedia literacy mean. Libraries are one of the biggest I guess, interventions we can make in terms of ensuring a level of equitable access, both to connectivity as well as to the skills development and the kind of programs of support that we can provide to many communities in need, as well as leveraging of a kind of economy of scale nationally in order to provide access to a lot of resources that any one library can't provide by themselves, and certainly not one school by themselves. I'd just like to mention one other thing in relation to libraries, and that is a service that is run both by the National Library, supported by the Ministry of Education, run by the National Library and public libraries in New Zealand, to provide a virtual online reference support service called Any Questions, which helps children not only find information online, but get support to develop the skills to navigate the information landscape with effectiveness and safely, and developing skills along the way. There is a lot more I could say on this topic, but I'll leave it at that.
I'm sure there is, and thank you for that. I think once again it was a comment unless anyone else had a response that they wanted to make. Ernie, go for it.
Yeah, Ernie Newman, consultant and occasional report writer. I too was very impressed with Kate Cornick's presentation and with the Institute, and I get very irritated when I see the Australians doing things better than we do. But I would like to ask Kate a question. In a nutshell, if we wanted to start an institute like yours in New Zealand, what are the first things we'd need to do? And then I'd just actually like to ask each of the rest of the panel in a sentence or two, if we started such an institute and you were given the opportunity to give it one of its first jobs, what would be one of the first things you get it to focus on?
Now that's a good question.
That is a good question. I think there's certainly some things that I would do differently if I was going back in time. I think one thing that I would be very careful, I have to be careful what I say here. One of the things that I would encourage was collaboration between multiple universities. Melbourne University was given the agreement, and that was the nature of our director of the Institute, who ultimately got the funding from the state government to set this up. I think it's led to an environment whereby we actually have to fund all our funding that we give out is distributed through Melbourne University. So we're effectively only tapping into the resources in Melbourne University, and then we're encouraging our researchers to collaborate externally. I think if that had been open to a statewide initiative, we would have tapped into other universities, such as Swinburne, and I know Robert's here, and other universities could benefit from what we're doing. One of the things that I think we have done quite well is get industry on board, and I think if you leave it only in the hands of academia, it will become academic, and I am an academic. I do have an academic background, and I think research is very important, but I think we need some research in this area, but a lot of what IBIS is doing is actually that interface between research and industry. And I think if we let research do it, and researchers in a purist way go about doing research, you actually don't necessarily get the results and deliverables. And that's been quite a cultural issue that we've addressed with a number of researchers. We have a number of researchers who are just fantastic, who want to be at that coal front of industry. There's a number that don't, and we respect that. But it has, there's certainly cultural issues within academia and interface to industry that I think is really the key issue. So make sure you get industry on board. Equally, industry needs to understand what the drivers are of academia. So I think that's a sort of probably broader issue, but I think it's fairly important. And government support, definitely. I mean, the government support, the government put up the cash along with the universities. I think that's a model that in our case has been successful. It would be nice to open that up to more universities in the future. And I think it comes back to the comment about you need all three, government, industry and universities working side by side, hand in hand, and have partnerships, genuine partnerships where industry is able to lead in some cases, universities are able to lead in other cases, and government can lead in some cases.
Should we make them feel really terrible and talk about NICTA as well?
NICTA, yes.
Yeah, where you did your PhD.
Yes. So NICTA is National ICT Australia, which is a government-funded entity to the tune of some hundreds of millions.
Well, over 15 years.
Oh, over 15 years, yes.
$560 million.
They are driving ICT in Australia. And ICT commercialisation. They're also doing the sorts of things that we're doing at IBIS. They are a fantastic outfit, brilliant organisation. They collaborate. They're one of our very big supporters in Victoria. One thing I would say about NICTA as one of our national institutes is that they haven't partnered with industry in the way that the industry is supporting the institute per se. They partner with industry around specific projects. And I think that's great for those individual projects, but when those projects come to an end, that partnership doesn't move forward. And I think the model that we've instigated at IBIS is the industry partner with us not on the basis of projects. They partner because they like our goals, and then they move forward to develop projects with them. So when those projects come to an end, and some of our projects have come to a natural end, the industry is still there to move on to the next project. And I think that's an important model in terms of having developments that are going to result in outcomes. You don't want industry just coming in for particular projects.
Okay, so now we then turn to the rest of the panel and give them the hypothetical. You've just the IBIS New Zealand has just been created. Do any of you have a first project that you want to give IBIS New Zealand to work on?
Yes, I would. I would like to see some really in-depth research looking at ways of teaching children to read by using technologies of some sort and monitoring it, because there are still far too many children whose literacy is quite low, and I think that just sets the sort of groundwork for lack of success and lack of engagement in school. And I know we've done lots and lots on reading over the years, but we don't seem to have cracked it, and I think I'd like to see some sort of technology interactive approach to that, and it would probably be useful to do it with Australia as well, since we seem to have some quite common areas of underachievement in the tail.
Can I comment on that particular application, because it's one that we haven't started but are very keen to do, and we're actually looking at trying to get our older retired population, our retired teachers, who have slightly different ways of teaching literacy in some cases, and connect them into schools potentially remotely. It's a project that we're really interested in getting off the ground, so if there's interest in collaborating on that, that's something that we could certainly explore.
I could also talk about the possible technology to replace the fact that there's many parents who aren't actually able up to the stage of helping to read with their children after school, and technology could easily fill that void. Anyway.
I would start by looking at approach rather than a specific project, and one of the approaches that has always appealed to me is the approach that RAND Corporation has adopted in the United States. Now, I know that their initial reason for doing that was around Air Force sort of capability and so forth, but what they did was essentially ignore what was there and how you could work forward and look at where you wanted to be and work back. It was a systems analysis approach, and I think that that's a kind of approach that we might want to think about with something like that, that you actually look out and say in 20 years' time, where is it that we want to be, whether it's with kids reading in rural settings, whether it's the kids currently in our school system who are not succeeding, where do we actually want them to be at? And then you work back from that and say, what is it that we need to do to get them there? As opposed to tinkering around with the current bits that we have, which we constantly do, and shuffle them around and end up achieving nothing more than we've already got. I mean, Einstein's, what was definition of insanity was, if you keep doing things in the same way and expecting a different result, you're nuts.
In the broadband world, I tend to think more of his other famous quote, which is never remember anything you can look up, which now means nothing.
Exactly.
Anyone else got a contribution there?
Yeah, sure. I've got a little pet project, and I like your approach, although I think incremental work can work. In New Zealand, we've got a lot of communication around health data that goes back and forth between GPs and practice nurses and hospitals, and we've got very clever systems now for making that data interoperable between systems, but we don't talk the same clinical language, and there's a clinical code set or terminology called SNOMED CT, which New Zealand needs to adopt, and I think the way that we can do it is by working with, we only have 5 major software vendors in New Zealand, and we've got standards that we can build around to do that. So that's my slightly geeky, personal favourite project. The other thing that I'd like to see would be the development offshore, but nearby offshore, of a vast wasteland of hot desert full of uranium, diamonds, gold and copper that we can scrape off the soil and sell to the Chinese, so we've got some money to pay for it.
I have an alternative suggestion for how you can achieve access to that, which is called the fact there's still a place for you in the Constitution of the Federation of Australia.
Yeah, well, maybe you're right. Maybe you're right.
I think I would start looking at what some of the definitions of success are and who is making those definitions. I think sometimes in medicine we have a definition which is the clinical definition. We focus on the clinical parameters. I think sometimes we focus on the financial parameters, but one of the things of working more closely with whānau ora and looking at sort of whare tapa whā and looking at the various dimensions of health, I think what we've got to do is start getting some databases which are able to give a more comprehensive view of what success is going to look like in the future.
I love the methodology in defining success ones. Those are projects in their own right. Writing a methodology piece that taking systems analysis into the future broadband world and say, here's a process, this is the methodology you should use to analyse problems would be a fun one. Louise, do you have one? You don't have to.
Yes. I mean, my passion is teacher education, so I'd like to develop something to do with teacher education.
Okay. Talking about teacher education and maths in particular, it always strikes me that I've discovered late in life that since I've been a student, they've invented these wonderful things like Mathematica and MATLAB and so forth, where you can actually do all that maths. Does that stuff get used in high schools, or does it only get used in universities?
There's a lot of programs that are used by students in high schools to increase and reinforce their mathematics.
Right, but not the really sexy top-end solving things.
No, I mean, students again can enrol in universities from school, and they can hook into things, but...
Yeah, no, it's just... It was only a personal question. I shouldn't use my position as speaker. Look, my program says that 5:15 I'm meant to sum up and conclude. Is that still correct? That's still correct? So I make it 5:15, so I'm going to give it one last call, because I actually think we've got a lot of information out of this fine panel about what the drivers for demand in education and health will be. I suppose we didn't actually really answer the question about moving on from pilotitis, but I don't think we're going to necessarily solve that today. So if you could please join me in thanking this fine panel and let them leave the stage.